Bismillahirrahmanirrahim. Today we are going to start with the disorders of the musculoskeletal system. This is a continuation of the online series of classes. We know that the musculoskeletal system consists of bones and cartilage, the joints, and soft tissues. And we will discuss disorders associated with the bones, cartilage, joints, and soft tissues. We take start from the disorders of the bones and cartilage, and for our convenience we classify the disorders of the bones and cartilage into congenital disorders. The very important disease is the osteoporosis, and the acquired diseases of the bone, which consist of the osteoporosis, which is characterized by excessive bone breakdown and decreased in the mass density of the bone. We will discuss Paget disease, also known as the osteitis deformans, which is caused by an uncoordinated process of the bone formation and bone resorption. We will discuss rickets in children and osteomalacia in adults, which is caused by vitamin D and calcium deficiency. We will discuss hyperparathyroidism, which is an endocrine disorder characterized by excess secretion of the parathyroid hormone from the parathyroid gland. We will discuss fractures, the osteonecrosis, particularly the avascular necrosis, and the osteomyelitis, which is the infections that occur in the bone in the form of either pyogenic osteomyelitis and the more prolonged and serious tuberculous osteomyelitis. We will discuss bone tumors and bone forming tumors, cartilage forming tumors, fibrous and fibroosseous tumors, and miscellaneous bone tumors. Now, to start with the acquired diseases of the bone, the four important diseases of the bone which are acquired and which are not congenital are the osteoporosis, the Paget disease, rickets and osteomalacia, and hyperparathyroidism. Before we start to discuss the disorders, we make a brief review of the normal structure of the bone. We know that the bone, for example, the long bones, for example, the femur, it consists of a surrounding layer of the periosteum, which consists of an outer fibrous layer and inner cellular layer. The compact bone is surrounded by the periosteum except at the level of the cartilages, where the take part in forming the joints, and on the inside of the compact or lamellar bone is the spongy or trabecular bone lying in the medullary cavity, which is surrounded by another layer known as the endosteum. And this medullary canal or medullary cavity contains the bone marrow, which is responsible for the production of blood and blood forming cells, as well as cells that take part in the immune system. The functional unit of a bone is the osteon, which is consists of lamellated bone tissue, and in the center of each osteon there is the Haversian canal, through which the blood vessels and nerves run, and there are interconnecting canals which are known as the perforating canals or the Volkmann canals, where the blood vessels run in it from the connecting different Haversian canals. And Mainly the bone consists of an organic component which makes 35% of the bone substance, and it consists of the proteinaceous osteoid which is secreted by the osteoblasts, and this osteoid seam mainly consists of the collagen, type 1 collagen, and the mucopolysaccharides. It also contains the bone cells, particularly the osteoblasts and osteocytes, which are the bone forming cells, and the osteoclasts, which are involved in bone resorption. The inorganic component of the bone, which makes about 65% of the bone structure, it mainly consists of calcium hydroxyapatite, which contains the uh, minerals like calcium phosphate and some other minerals like sodium, magnesium. And these calcium and phosphate salts are deposited in the osteoid seam which form the organic component, and this process is known as the bone mineralization. The bone serves many functions. For example, it supports the body, protects the soft organs, for example, skull and vertebrae for the brain and spinal cord, rib cage for the heart, lungs, the visceral organs in the thoracic cavity. Bone allow movements in association with the attached skeletal muscles, and the bones are also storehouses for minerals as well as the fat, because the yellow marrow contains lot of fat, and the minerals which are stored in the bone, the major ones are the calcium and phosphate. And the bone marrow, which is the site of the formation of the blood forming cells and also cells that take part in the immune response of the body. Now, we know that bone is not an inert structure. It is a dynamic structure, and it continually undergoes the bone remodeling, which is the process in which the old bone is replaced by the osteoclast. The process is known as the bone resorption, and new bone formation, which is made by the osteoblasts. And there is these two processes are very tightly regulated and controlled. And any abnormality, if there is excess bone formation, for example, it will result in Paget disease, and if there is excess bone resorption, it will result in osteoporosis. Whatsoever, these two processes depends mainly on the serum calcium level, and we know that the serum calcium level is controlled by the parathyroid hormone, which is released in response to hypocalcemia and which will increase bone demineralization by activating the osteoclasts, and the calcitonin, which is secreted by the parafollicular or C cells of the thyroid gland, and the vitamin D, which we receive through nutrition and diet, and also the cholesterol in the skin on exposure to sunlight is converted into cholecalciferol, which is processed in the liver and kidney, and finally it is converted into 1,2,5 dihydroxycholecalciferol or active vitamin D3, and also known as calcitriol. And this calcitriol or active vitamin D3 will increase absorption of calcium and phosphate from the gut, and thus provide calcium to be deposited in the bones in the process of mineralization. So we know that the bone is a dynamic structure. It continually undergoes replacement and new bone formation, and we say that the spongy bone or trabecular bone is replaced every 3 to 4 years, which lies in the inner structure of the bone, and the outer hard compact bone or lamellar bone, it is replaced every 10 years. Now, the peak bone mass is the bone mass or the maximum or bone with maximum strength and density, and we achieve this peak bone mass in the 20s, on average from 20 to 29 years of age. And this peak bone mass is very important because later on, when the person becomes affected by diseases that affect the bones, this peak bone mass play very important role. A person with a strong peak bone mass will deal with the diseases in a best way than in a person who is having the weak peak bone mass. In the young age, bone formation is more than the bone resorption, and it will continue up to the age of 30 years. And by this accelerated bone formation and decreased bone resorption, we get a peak bone mass that will remain in the remaining life. The formation of the peak bone mass is affected by genetics. Some people have very strong bones and some people have bones which are comparatively weaker. It also depends on the nutritional supply, for example, vitamin D and calcium. And certain hormones like estrogen and androgens like testosterone, they also affect the peak bone mass if they are used in the early young life. Physical activity is very important, and people who are physically active or undergo certain types of exercise, they achieve a strong peak bone mass than as compared to the people who have a sedentary lifestyle. So these are the factors that will affect the development of the peak bone mass. Now we come to the disease osteoporosis after discussing some basic information related to the bone. So what is osteoporosis? Osteoporosis is an acquired condition, and it is characterized by the reduced bone mass. Osteoporosis will decrease the bone mass or bone density. And why this happens? Because in osteoporosis, the bone resorption is more than the bone formation. Osteoporosis accelerates bone resorption, and the bone formation in comparison is less, and it will result in the formation of porous bones, bones with pores having decreased mass or density, and therefore they are more susceptible to fractures even from minor trauma. We know that osteoporosis is the condition in which the bones become porous, porous formation in the bones. It is an acquired condition characterized by increased bone loss as compared to a normal person. And in osteoporosis, the osteoclasts become more uh, active and vigorous, causing increased bone resorption, while the bone formation is, as compared to the bone resorption, is less, and this will result in decreased bone density or mass, and the weakened bones are more susceptible to fractures. Now we classify osteoporosis into generalized osteoporosis and localized. In localized osteoporosis, for example, the disuse of a limb due to fracture or due to some disability, it will undergo more accelerated osteoporosis. And here we can say that mostly it is due to the lack of exercise. In localized osteoporosis, a part of the bone is affected, while in generalized osteoporosis, the whole skeleton is affected. We divide generalized osteoporosis into primary osteoporosis, which is most common, and we further divide primary osteoporosis into the senile osteoporosis that occurs naturally with the advancing age, particularly after the age of 70 years. And the very important is the post-menopausal osteoporosis that occurs in the female due to the deficiency of estrogen after the menopause. Rarely, the secondary form of osteoporosis are seen in endocrine disorders, for example, in hyperparathyroidism and under secretion of the vitamin D and the calcitonin, and certain gastrointestinal tract disorders in which there is poor absorption of calcium phosphate and vitamin D, and certain drugs like anticonvulsants or anti-seizure drugs, they may also result in the porous bones or osteoporosis. And we know that the porous bones are bone affected by the osteoporosis due to the decreased bone mass and bone density. Their susceptibility to fracture is increased, and even a minor trauma can cause fractures in these bones. Now, we have discussed the peak bone mass, and we know that the peak bone mass is affected by the factors like genetics. Some people genetically have strong bones and others have comparatively weak bones. The peak bone mass also depends on the nutrition, adequate supply of vitamin D3, calcium phosphate, and it also depends on physical activity. A person who is physically active will have a stronger peak bone mass than the people who live in a sedentary life. The two major types of osteoporosis are the senile osteoporosis, which is associated with aging, and it is said that with increased age, what happens that the replicative activity of the osteoprogenitor cells is decreased, and decreased formation of mature osteoblasts occur. In addition, the synthetic activity of the mature osteoblasts also decreases with the age. There is decreased biological activity of the matrix bound growth factors, and as a person ages, the physical activity and exercise, they are decreased, and the cumulative effect of all these factors result in the senile osteoporosis or osteoporosis that is related to the age. Very important is the menopausal osteoporosis that occurs in the female after the menopause. When a female stops menstrual bleeding, and what happens that in the menopause the ovaries become atrophic and there is decreased serum estrogen, and estrogen has got its effects on the bone formation, and the decreased serum estrogen will result in the increased secretion or release of the certain cytokines like interleukin 1, interleukin 6, and tumor necrotic factors from the bone cells. Additionally, the decreased estrogen level and after the menopause, the rank receptor activator for nuclear factor kappa B in the osteoclasts and the rank lesion which activates this rank receptor, and the result is the activation of the osteoclasts that are involved in bone resorption. So with lacking estrogen and after the menopause, there is increased expression of the rank and rank lesion, and there is increased osteoclast activity that will cause bone resorption. So the result of all these causes will be the osteoporosis and the porous bones and with its related consequences and effects. Now, morphologically, what happens in an osteoporotic bone? And one thing that I want to clear at this point, that mostly the patients, they have no symptoms. So they don't seek medical advice, and it is only when a fracture occurs and the patient seeks medical advice, for that we come to know that the patient suffers from the osteoporosis. And at that time, the mostly the disease is in an advanced stage. Morphologically, what happens that the trabeculae that are present in the spongy bone, they are decreased, fewer trabeculae are left. The cortical or lamellar bone, it becomes thin. The Haversian canals become widened, and all these changes increase the weakness of the bone, and an osteoporotic bone carries high risks of pathological fractures. Particularly the spongy bones are more prone, and this type, and the osteoporosis, post-menopausal osteoporosis, mostly affects the spongy bones. Morphologically, the hallmark of osteoporosis is the loss of bone density or bone mass. So what happens? The cortical bones, they are thinned, the Haversian canals are dilated, and in the spongy bone, the trabeculae are reduced in thickness and they lose their interconnections. Particularly in post-menopausal osteoporosis, the trabecular bone loss is more severe as compared to the senile osteoporosis. And this will result in compression fractures and collapse of the vertebral bodies. So, in post-menopausal osteoporosis, the major types of bones affected are the vertebrae and the radius. While in senile osteoporosis, the loss of the cortical bone is more prominent, and it will make the person or increases or predisposing these bones to fractures, particularly the weight bearing bones like the hip bones or femoral neck. In this picture, we can see a normal vertebrae and a vertebrae that has undergone osteoporotic changes. So we can see that the vertebral body is shortened by the compression fractures, and the affected vertebrae show loss of horizontal trabeculae and the thickened vertical trabeculae and the interconnections of the trabeculae. As we discussed, the two most common types of osteoporosis are the post-menopausal osteoporosis that occurs in aged women, and the senile osteoporosis, more common at the 8th decade of life. And if we see that a woman with post-menopausal osteoporosis is exposed not only to post-menopausal osteoporosis but also to the senile osteoporosis due to her advanced age. The decreased ability of the osteoblast to form bone is the major cause of the senile osteoporosis, which is affected by certain factors. And in senile osteoporosis, the loss of cortical or lamellar bone is more prominent, while in postmenopausal osteoporosis, which is caused by the increased osteoclastic activity or increased bone resorption, in postmenopausal osteoporosis, the loss of spongy bone is more prominent as compared to the cortical bone loss in the senile or aged osteoporosis. Commonly, the vertebrae are affected and compression fracture occurs in both types, and in postmenopausal osteoporosis, most commonly the distal radius is affected, and the compression fractures or loss of the bone density in the vertebra may lead to increased curvature of the vertebral column where the person looks at the ground. And in senile osteoporosis, the fracture of the femoral neck and hip bone is more prominent. So the summary of the osteoporosis is that in osteoporosis the bone density is decreased. There is increased bone resorption as compared to the bone formation. The two most common types are the senile osteoporosis and postmenopausal osteoporosis. And the most common fractures in osteoporosis are the compression fractures of the vertebra. Morphologically, the cortical bone becomes thin and weak, the Haversian canals become widened, and there is decreased number of the trabeculae in the trabecular or spongy bone. The diagnosis of the osteoporosis, it is done by the DEXA scan or ultrasound, which will calculate the T-score by comparing the bone density of the patient to the bone density of a normal person with no osteoporosis of the same age and health, and then we will calculate the T-score, and the T-score equal to minus 2.5 or less than 2.5 is diagnostic of the osteoporosis. The treatment of the osteoporosis consists of the bisphosphonates that decrease the demineralization or the osteoclastic activity of bone resorption and other supportive measures. Thank you very much.